Hello everybody and welcome back to Torn. If you're new to the channel, I'm Dr. Mark Wygand. I'm a board certified sports physical therapist, and the goal of this channel is to help simplify and educate on the ACL injury. In this video, we're going to talk about one question. After an ACL injury occurs, what is the next step? And do I need surgery? My goal for this video is to not make that decision for you, but allow us to go through the decision-making process and talk about the factors that come into play when we make the decision whether or not to go down the surgical route or the conservative route. To have a better understanding of the decision-making process that we go through to determine whether or not an ACL surgery is required, let us first break down what the job of the ACL is. So specifically, the job of the ACL is to stabilize the joint. It acts as a main stabilizer to the knee. So specifically, the job of the ACL is to prevent the shin from moving too far forward on the thigh bone or the femur. A secondary role of the ACL is to prevent a rotational stability. So if I go back to the knee model, it helps prevent rotation as well. And that comes into play when we talk about sports that require cutting, pivoting, landing, and turning. So when we look at the reasons why we're going to take or go down a surgical route versus a conservative route, these are kind of some of the factors that come into play, and we'll talk about those next. So once an ACL tear is confirmed, we have essentially two options. The first route is surgical route, where it's a full reconstruction, where we take a graft and essentially replace it with the ligament that was torn. The second option is a conservative treatment or a non-surgical route. I want to make the caveat that no matter what route you're taking, whether you are a candidate for surgery or you're a candidate for conservative treatment, there is a rehab process that takes place. And much to the surprise of people, when we go down even a conservative route or attempt it, it doesn't necessarily mean that we can just sit back and let the ACL heal. There are a lot of factors that come into play from our rehabilitation standpoint that help improve the likelihood that a conservative route will last. So when you sit down with the surgeon for the first time, likely we'll talk about options. So when we talk about conservative versus surgical route, likely there are a handful of factors that your surgeon will speak with you about, and let's talk about those next. So one of the first major questions that a surgeon will ask is, what do you want to get back to doing? What are your goals? What are your aspirations? And that is a huge factor when it comes to making the decision between a surgical route versus a conservative route. So when we look at these different, movement patterns, whether it's jumping, landing, cutting, contact, in soccer, basketball, football, sports like skiing, these are all important factors that we take into account as medical professionals, and something that is a huge part of the decision-making process to go down a surgical route. Conversely, if you're going back to something like daily normal activities, just walking, those types of things, maybe potentially running, all of these activities that require a little bit more of a straight line, that's a different story. So when you are getting back to something that requires high level movements, generally an ACL reconstruction is recommended. Second factor, instability. So what do I mean by this? After the ACL is torn, just like I mentioned, after the ACL is torn and you no longer have the stability of the joint, whether it's rotationally or that knee shifting forward or the shin shifting forward on the femur, you lose a lot of stability. So the goal of the ACL is to help prevent that instability. So after an ACL tear, generally one of the biggest symptoms or talking points that an athlete or whoever will say is, I feel very unstable, like my knee is going to give way. This is another huge factor that a surgeon will take into account and kind of play a role in the decision-making process to go down a surgical versus a non-surgical treatment, along with the factor of activity levels that we just talked about. So if you are having a significant amount of instability with just daily normal activities, generally the surgical route is recommended as well. So a third major factor in the decision-making process is, are there any additional injuries? So often when ACL tears occur, there is secondary pathology, meaning meniscus damage, other cruciate ligaments, meaning the PCL, potentially cartilage issues, and even the other collateral ligaments, meaning the MCL or LCL. So aside from the ACL acting as a main stabilizer, these other structures add a significant amount of stability as well. So when you look at the meniscus and its job to, help cushion the knee and provide some support as well, when you look at the other cruciate ligament, the PCL, and these collaterals, the MCL and LCL, if you have an ACL tear along with one of these other issues, that increases the likelihood of instability. So if you do have secondary pathologies or these additional injuries to the knee aside from the ACL, that is a significant factor when it comes to a surgeon deciding, or the joint decision, whether or not to go down the surgical or conservative route. When you have additional instability along with the ACL, your function or daily living activities significantly decreases, and most likely that will not heal on its own. Additional factors that we want to consider on top of kind of the main three that we've already discussed: pain can be a factor, and potentially range of motion loss as well. So after an ACL tear, especially when you've had additional meniscus injury, for example, there is the potential for an increase in pain, but also the potential that you don't get back your range of motion either. So a lot of times after meniscus injuries, the ability to completely flex the knee or bend the knee, along with the ability to get that knee completely straight, actually diminishes as well. So obviously we want to get back to some sort of normal daily activity. And if you don't have the capacity to do something normal like walking, stairs, those basic simple tasks, this can also be a factor that comes into play whether we go down the surgical or conservative route. So more often than not, athletes or patients generally fall kind of under one of those factors that we've previously discussed. And along with the surgeon's conversation, along with the athlete's parents or the patient themselves, the general consensus is to provide the stability that's required for the knee. The surgical route is the most common route. However, there are times in which a conservative treatment can come into play. So if you are a potential candidate for a conservative treatment or a non-surgical route for an ACL tear, what are the factors that come into play? Well, for a lot of them, they're almost the opposite of the 3 or 4 that we just discussed. So the first and foremost is, what are you getting back to doing? If you're getting back to something, of normal daily activities, or even just something like straight line running, this could potentially be an option for you. If you're getting back to anything more than that, like we discussed, probably going down the surgical route at that point. The second thing we would look at is, what is the stability like of the knee itself? So if you're walking and doing daily normal activities and you're having a lot of instability, or the knee feels like it's giving way, probably going down the surgical route as well. If you have a decent amount of stability and some of those daily normal activities actually feel pretty good, this is another good sign that a conservative treatment might be an option. The third thing, as we discussed, is what are the secondary pathologies or additional injuries that you might have. If you do have additional injuries, again, we're probably going to push toward the surgical route for the continuation of having a nice stable knee. But if the culmination of those few factors, comes into play, the potential for a conservative treatment increases. Other things that we want to look at is, what is your pain level like, or what is your range of motion like? We also want to look at something like age. Does age play a role potentially? If you're a 12 or 13-year-old or even a high school student who has an ACL tear, that's probably more leaning toward that surgical route, because we want to provide the stability for decades going forward. If you're, potentially in your 40s, 50s, 60s, and you're just a basic activities of daily living, this could be a potential for you. So I want to be very clear that even if we consider the non-surgical or conservative treatment, that also still requires a significant amount of rehab. So just because we don't have the surgery doesn't mean we can sit back, even though there is some evidence to support that over time, for some cases, the ACL has the potential to heal. It doesn't mean we can sit back and do nothing. So even though we haven't had the surgery, there is still a lot of rehabilitation that has to take place. From a strengthening standpoint, from a neuromuscular or balance standpoint, there are a lot of factors that come into play. And all of this research that is supporting the ACL recovering itself, all of these patients have gone through a substantial amount of rehab as well. If you found this video helpful, like, subscribe, comment below, ask questions, or even share with others that may be going through something similar. If you are considering the surgical route, above I've linked the different ACL graft options and what might be useful for you. As always, thanks for watching, and we'll catch you guys in the next video.